Hi, I'm Major Mike Webb, and I'm running for U.S. Congress in Northern Virginia, in Virginia's 8th Congressional District. But for 2 decades, I served in the United States Army, primarily focused on force projection and force protection. And ultimately in the Army, it's all about force protection and keeping our boys and girls safe as they engage in the hard work of freedom, meeting the enemies of our nation in multiple hotspots around the world. But for the next few minutes, I'd like to talk about an invisible enemy, and a topic that has generated a lot of partisan debate about how to keep Americans like you safe from a novel coronavirus that has gained the popular name of COVID-19. There is a lot of complex science involved in the topic of infectious disease control. And I wish that there was an easy way to cram every piece of information into your head, but there is not. And in a pandemic crisis, time is not a luxury that we have. So let me begin by providing a general framework about the goal of infectious disease control, which is actually quite simple to understand in 3 easy steps. It is the goal of infectious disease control first to identify the source of infection. And that encompasses a whole lot more than simply knowing that we have a pandemic crisis. Pandemic is just a term to describe a stage of proliferation in epidemiology that connotes the fact that a pathogen is present all over the world. But that does not mean that it is a direct threat to you in your household or your community. When we identify the source of infection from a respiratory tract virus, what we need to know to keep you safe is how it is spreading to infect you individually, because it may not be spreading from person to person, even though it seems like that because infections are rising everywhere. We need to know exactly how it is getting to you to proceed to the next step, which is creating a barrier or blocking whatever is going to make you sick or maybe even die. And if it is a respiratory virus, there is one critical determination that is going to complicate that determination. Exactly how much of that virus has to enter your mouth or nose to cause you to be infected and get sick and possibly die. Virologists and epidemiologists call that an infectious dose. Your body is equipped with a complex immune system that has successfully defended against multiple viruses, which are the most abundant biological particles in the world. And your immune system is so effective that even today, there are only about 220 viruses that are harmful to man. And because of your immune system, believe it or not, you actually don't have to worry about that one particle or one droplet that can travel over 26 feet at speeds exceeding 200 miles per hour, because it's not in a sufficient mass to cause you any harm. So let's talk about a novel coronavirus and what we have to block. An N95 medical mask can prevent penetration of 95% of microbial particles. And the good news for medical professionals is that 5% that can get through has not infected anyone yet to date with a novel coronavirus. Not even one. Beyond that, however, no scientific study has yet determined that exact critical mass that has to reach the entrance of your mouth or nose to cause you to have a positive test or develop symptoms from COVID-19. But there is strong, encouraging evidence in scientific studies that suggest that that quantum is pretty darn high. And this should be encouraging news to you if you are engaged in critical jobs like caregivers, cashiers, sanitation workers, farm workers, and public transit employees who have to go to work, because casual contact has not been found in any study to create optimum conditions for a sufficient viral load to be transmitted into the entrances of your nose or mouth to make you sick. And so the almost 30% of the African Americans employed in the work of education and health services industries and 10% in retail can breathe a sigh of relief. And there is actually a scientific study that you can examine for yourself on the internet, upon which an environmental engineer named Lindsay Marr at Virginia Tech relied with others to conclude that a novel coronavirus is not being transmitted from person to person but in the air as an aerosol or droplets and particles measuring less than 5 microns. And if you need more assurance, Lindsay is an environmental engineer that Senator Tim Kaine respects and admires. So let's talk a little bit about that study and exactly what they found. A man now known to have been infected with COVID-19 in Wuhan traveled over 600 miles to another city with 4 members of his family to have lunch in a restaurant dining room, measuring 145 square meters and located on the 3rd floor of that restaurant. 600 miles is a long time to be with anyone, but somehow during that journey, the infected man failed to infect the members of his family. Each table in the restaurant, a total of 15, was exactly 1 meter apart. A total of 91 persons, 83 customers, and 8 staff members were in the restaurant. However, not even one staff member became infected with COVID-19. Not even one. Their brief interaction with the infected person did not provide sufficient exposure to any level of contamination that met the threshold for an infectious dose. However, the 2 people at the table in front of the infected person, with whom their times in the dining room overlapped by 53 minutes, and the 3 persons seated at the table behind him, with whom their times in the restaurant overlapped by 73 minutes, received a sufficient infectious dose to not only infect them, but also send them to the hospital, regardless of age, ranging between 20 and 84, or even regardless of prior medical condition. Only 2 persons had hypertension, the infected person, and another person at his table. And that other person also had hyperlipidemia. Yet no air sample tested beyond 3 hours yet to date has recovered a sufficient quantity of viable particles to present a threat to anyone in an infectious dose. And almost immediately after departing the restaurant, the infected person somehow began to exhibit full-blown symptomatic presentation and was immediately hospitalized. The only person infected in that restaurant were those 10 seated in an area measuring 30 square meters and serviced by 1 air conditioning vent. The restaurant staff and the other patrons in the restaurant did not require any protection at all to prevent them from being infected. And this study relied upon by an environmental engineer respected by Tim Kaine to endorse the theory that a novel coronavirus is not an infectious disease being transmitted from person to person, but rather as an aerosol through particles in the air, provides a lot of detail on exactly how a novel coronavirus is infecting people. But still the governor, Tim Kaine, Mark Warner, Joe Biden, Don Beyer, and other Democrats not only believe that you should wear a facial covering, but also believe that you should be mandated by law to wear one, to remind you of the dangers of the pandemic. In July, through robust litigation, we were able to pressure the Centers for Disease Control and Prevention, as well as the Virginia Department of Health, to clarify exactly the type of protection that a facial covering provides. The only value that it has in infectious disease control is in preventing an infected person from spreading large quantities of infectious particles by facilitating rapid evaporation and absorbing droplets being expelled when that person talks, coughs, or sneezes. And that holds for any type of viral infection. This is science that CDC now admits has been known for years, despite rashes of recent studies funded by the World Health Organization and other agencies and promoted as evolving science in the press. And we are currently in litigation at the Federal District Court in Richmond to strike down the facial covering mandate in Virginia on the basis that Governor Northam has never demonstrated that COVID-19 is a communicable disease being transmitted from person to person. Like measles, which infects 90% of the people with whom an infected person comes in contact, or smallpox, which infects 60% of the people with whom an infected person comes in contact. And that is the only authority that he had to issue an executive order under law, while the United States Department of Justice has now begun to request data from governors of states that issued orders that may have resulted in the deaths of the elderly in nursing homes. My name is Major Mike Webb, and I am running for U.S. Congress with liberty, honor, and excellence. By God, we shall make America great again. Honest. This advertisement was authorized by Mike Webb.